If you've ever felt sharp pain in your heel when taking your first steps in the morning, you might be dealing with plantar fasciitis, one of the most common causes of foot pain. Plantar fasciitis happens when the thick band of tissue under your foot, called the plantar fascia, becomes irritated or damaged.
This band connects your heel bone to the base of your toes and supports your foot arch.
The main symptoms? Pain, tenderness, and stiffness, all focused on the sole of your foot, usually close to the heel. It often feels worst when you first get out of bed or start walking after resting. Many people say it improves after a bit of activity, but then comes back at the end of the day. Some describe the pain as dull or aching. Others feel sharp, stabbing, or even a burning sensation. For some, it can feel like walking on small stones or pebbles. You might notice the pain in just one foot, but for around 1 in 3 people with plantar fasciitis, both feet are affected. The most painful spot is usually where the plantar fascia connects to the heel, or a little bit further forward on the sole of your foot. This area can feel especially tender to the touch. Stiffness is another common sign, especially first thing in the morning. It usually eases as you move around. If you've had symptoms for a few weeks with no improvement, or if the pain is severe enough to stop you walking comfortably, it's a good idea to speak to your doctor or a podiatrist. The same applies if you have tingling or numbness, which might point to a nerve issue instead. People with diabetes should be especially careful. Foot pain can be a sign of other conditions that need attention. Your doctor may diagnose plantar fasciitis based on your symptoms and a physical exam. They might check for tenderness around your heel or ask you to stretch your big toe, a test that can trigger pain if the plantar fascia is inflamed. In most cases, scans like X-rays or MRIs aren't needed. They're usually only used if there's uncertainty about the diagnosis or if your doctor suspects another problem. Several other conditions can mimic plantar fasciitis. These include Achilles tendonitis, fat pad atrophy, certain muscle or tendon injuries, stress fractures, and even arthritis or nerve issues. So if your symptoms don't quite match up or if they're getting worse, don't ignore them. Getting the right diagnosis is the first step to effective treatment. For more clear, practical advice on managing common health issues, subscribe to our channel and explore our other videos. We're here to help you stay active and informed, one step at a time.